Hello, everyone, and welcome to Pascack Valley Medical Center's Facebook Live event, live from the OR. So I'm Dr. Amit Trivedi. I'm the chairman of surgery here at Pascack Valley Medical Center, and I'm joined by my colleague,
Dr. Sarah Wong. I'm one of the general bariatric surgeons I work with Dr. Trivedi.
Right, so we're pretty excited to come to you live from operating room 2, where we have a lot of technology that you see kind of around us that we use to give safe operations to folks that need bariatric surgery. We do a lot of bariatric and general surgery. Mm-hmm. And why we're here today is to show off some of this technology. So we're going to give you a little bit of tour here of some of this equipment and these robotic arms that you see around us today. I'm going to tell you a little bit about bariatric surgery. We're going to take some questions that were sent in and tell you why this is all important in terms of getting a safe operation and getting healthy. Our goal here at Pascack Valley Medical Center is to make sure that everyone can be healthy. And we want everyone to be the best version of them that they can be, right? And for a lot of folks, it's getting that health under control that gives you that potential. We see many people in our practices, Dr. Wong and I, that struggle with their weight. And while we don't define anyone by their weight, we know that the weight has some health consequences, that once you get beyond a certain point in the weight, certain health consequences can occur. So Dr. Wong, can you tell us about some of the health consequences that can occur as the weight rises?
Right. I'm sure a lot of you are familiar with some of these diseases. A couple of them are diabetes. A lot of folks have diabetes or insulin resistance, or they also have hypertension, also known as high blood pressure, hyperlipidemia, high cholesterol, something called sleep apnea. If you snore and you're not getting enough sleep at night, you have something called sleep apnea.
Right. And there are a whole host of other diseases as well that go with it. And when we talk to patients, we see that even little things, like sometimes even tying shoes, become very difficult as the weight goes. Walking from one end of town to the other becomes difficult, or up the stairs to get winded. And these are all health conditions that can be helped with weight loss. And the way I like to think about it is that if you're experiencing some of these diseases that require medication, and you're getting a little winded, trouble tying shoes, knees hurt, hips hurt, if you think back when you were much lighter in weight, for many people that's many years ago, those concerns weren't there. When people were thinner, often they didn't worry about diabetes or high blood pressure or their knees. And I think some of the tools that we offer here at Pascack Valley Medical Center, some of the surgeries that we do that we're going to talk about, help get you back to a point where you were at a weight where you didn't have to worry about a lot of these things. Right. And that's kind of the importance of what we do, right? So what we're going to do today is we're going to tell you a little bit about bariatric surgery. So bariatric surgery is using surgical tools like this to give you an operation, which is a tool to help lose weight. Now we have two main operations that we do. There are some others, but there are two main ones that we do. So Dr. Wong, if you can just tell us briefly about what the two main operations are that we do for weight loss.
So the two main operations are the gastric bypass and something called the sleeve gastrectomy. And basically a short summary of them are the bypass involves making your stomach smaller and bypassing some of the chemicals that help you break down certain foods. So you're not absorbing as much as you would normally eat. Whereas the sleeve, it's a more common procedure nowadays, is taking out 2/3 to about 3/4 of your stomach and taking away that hormone called ghrelin. You may have heard of it. It's a hormone that makes you hungry. So without that hormone, you're not as hungry. So both of these operations probably take about an hour, maybe 2 hours, 3 hours tops. And then, you can live the rest of your life by losing this weight.
That's right. So you see, there's two main operations, like Dr. Wong said, the gastric bypass and the sleeve gastrectomy. Now, many people in the audience may have already done some research on these operations, and we're going to leave a link at the bottom of this Facebook page with more information on these operations, and you can actually see animations of these operations. So that's going to be really good. But you said a couple of important things, Dr. Wong. First, you said that these are more metabolic operations. So before, there was a time when people thought, okay, you're eating too much, you're not exercising. We've heard it all, and it's turning out to be that that's not true. The truth of the matter is, what causes someone's weight is metabolism, and we're learning things about hormones, receptors for these hormones, and even bacteria in our intestinal system that process food differently. Now, that's nothing that anybody can control. That's just a disease. All right, so if someone has a different set of bacteria, they might be heavier. Or if their hormone receptor for this ghrelin hormone is more sensitive, they may be heavier. And these operations that we do help correct that balance to get that weight way down, right? And our program's a little bit different here. So what we do is we want you to get to be the best, healthiest you can be. And that usually means, for a lot of the patients that we meet, a good amount of weight loss. So we offer these tools, and we use this technology that we're going to show you in a second to help get those operations done in a nice, safe manner at our hospital. Our hospital is also very unique. If you don't know much about Pascack Valley Medical Center, it's a small community hospital here in Westwood, New Jersey, and it's a very boutique hospital. So we have a nice core staff of nurses and techs and everyone that works with us that's all involved in taking care of the patient. Every room is a private room here, and even the nursing, it's pretty much practically your own nurse that takes care of you. And the care in this hospital has been excellent, and that's why Dr. Wong and I choose to develop this hospital and participate in the care of patients here. So we're going to jump right into it, and we're going to talk about this robot system here. And you can see 2 of the 3 robotic arms that are here. This system is called the Ascensus Surgical Senhance System, and it consists of 3 robotic arms, and here's 1, here's 2, and here's a 3rd one behind me that you'll be able to see. And the patient would be here, and we would use these arms, and I'll show you a console here in a second when I go on there, when you can see these arms move, to do a very precise operation. We use the ability of these arms to really move the surgical instruments inside the patient in a very precise and delicate manner, so that there's less pain, less injury to tissues, and better ability for us to see and dissect and give you really a safe operation. And we're going to talk about some of the advantages in a second as well. But what I'm going to do over here is I'm going to go over here to our console, and I'm going to show you how these arms work. So if you follow me over here, this is our surgical console. So you see how technology is advanced. Before, surgeons used to be at the bedside, but now here, during the operation, Dr. Wong and I, or I sit here, and one of us stays at the bedside, and I use these instruments, right, in a nice seated position to precisely control those arms that you see over there. So I get to see on this big screen here a nice 3D visualization of the anatomy. And I actually wear these 3D glasses during the operation, and I can put this on, and it changes my screen into a 3D vision onto the screen, so I can actually operate and see everything in 3D, and that just makes it that much more precise and clear. And this is a nice 4K monitor, so our visualization is incredible. So I'm going to take these off just so you guys can see me. And these are our surgical instruments. The computer here will translate the motions that I make into computer motion, and the computer motion will be increased in precision and the amount of delicate movements that it can make, and I'll be able to move. So here we go. So I'm going to press the clutch here, as we call it, and I'm going to start moving these instruments. And what we're going to do is we're going to start panning these instruments, and you'll be able to see me move these instruments, you can see, in an extremely precise manner. And what I do on the screen here, the arms will do with the instruments. Now, obviously, we don't have the patient here. We don't have the instruments attached. But for demonstration purposes, you can see how nicely these move and how fluid the motion is. And that's something, and I think this is important because a lot of patients don't get to see what we do in the operating room and understand that a lot of technology goes into moving these arms. And you can see here, we can do pretty much what we need to with these arms. And there's actually 3 of them. We only have 2 set up here. So I'm going to put these instruments back, and I'm going to walk over. And I'm going to walk over here. And that was pretty impressive. You know, no matter how many of these that we do, I still get very impressed with this technology. And our patients have really benefited from it. So I'm going to turn it over to you, Dr. Wong, for a second here. And maybe you can just tell us a few of the advantages of doing surgery using the robotic technique and why it's important.
So again, you know, the robot has a lot of advantages, and Dr. Trivedi mentioned a few of them. One is the nice 3D vision. So again, we are able to see the tissue, the organs next to the stomach or the intestines, the liver, the gallbladder, all in 3D. So it helps us, again, operate precisely. So the robot helps us control any fine motor kind of twitchers or tremors that we might have into nice, precise, smooth movements so that, again, we're operating safely.
Right? So very impressive. And again, we're fortunate here at Pascack Valley Medical Center to be able to bring this technology to patients. And if you talk to a lot of our patients, they've been really benefiting. One of the other things that we do during these operations, and we get this question a lot, is what is it like after surgery in terms of discomfort and pain and things like that. So Dr. Wong, any comments on that? And maybe tell them a little bit about what we do to actually minimize pain after surgery.
Sure. In the operation, we actually give you numbing medicine or local anesthesia into the abdomen around the nerves that innervate your abdominal muscles. And that usually lasts a few hours. So a lot of patients, when they wake up, they kind of describe their pain as more of a discomfort or soreness, you know?
Like you did a lot of sit-ups kind of pain.
Exactly. And a lot of the times they don't even require any narcotic or opiate medications because we know how those can become dangerous and addicting. So a lot of the times they just rely on medications like Tylenol and Motrin to control their discomfort.
All right, so you can see how surgery's come such a long way. When I started surgery over 20 years ago, we used to give a lot of narcotics, 20, 30, 40, sometimes even 50 tablets for post-surgery patients to take home. We don't do that. Most of our patients at Pascack Valley that get our bariatric surgery go home with no prescription for any pain medication because they don't need it. And that's that technology that Dr. Wong said, where we numb up some of the nerves that cause some of that discomfort. And that's just a great step forward in surgery. So thank you for sharing that with us, Dr. Wong. And then, you know, if you're interested in bariatric surgery or even general surgery like we do, right? Because we do other things as well using some of this technology and other robotic technology that we have here at Pascack Valley Medical Center. And many of you may have seen our hernia video that's also linked below. If you wanted to contact us, we'll leave the link below. But Dr. Wong, tell us about the process. If someone's interested in bariatric surgery, how do we go from thinking about it to research to eventually being in operating room too as a patient that'll benefit from surgery?
Absolutely. So it's a pretty simple process, but it is a process. So one of the first steps is to contact us, and we'll leave, again, our contact information at the end of the presentation. Call the office, and you can make a one-on-one consultation with either Dr. Trivedi or myself to talk about the different surgery options for you. So again, the sleeve, the bypass, or again, if you're interested in general surgery, we do hernias, gallbladders, anything, small bowel resections, colon resections. So that will be the next step. And we're lucky that we're in network with the majority of all insurance programs. So, you know, call your insurance company, but our office will also check for you to make sure that, again, things are covered. So after you sit down with us, and again, we talk about all your medical issues, if you have any surgical history that you've had, any issues with anesthesia that you've had in the past, and we go through everything in detail with you because we want you to feel comfortable. And once we know which procedure you're interested in and which one is the best fit for you, then the next step is insurance approval, where our office, again, will help you through that process. Usually it requires medical clearance. We want to make sure that we're doing a safe operation for you, and we want your medical doctors to be involved. So we want to make sure that they're on board and we know that we're doing the safe thing for you, okay? If you have any things like heart conditions, lung conditions, we also want those specialists to be involved. After those clearances, then it's, insurance, approval, some paperwork. Next thing you know, you're scheduled for here in surgery,
Right. And that's the process. I mean, it sounds a bit daunting, but we give you a coordinator that takes care of all of this stuff for you and just gives you checklists and just make sure it's nice and smooth. But the key here, as Dr. Wong stated, is that we want safety. So we get the clearances that you need, make sure that every doctor that we need, heart doctor, lung doctor, whoever is needed, signs off to make sure that you have a safe operation. And then that's when we get to use our technology to, again, give you a safe operation. And then afterwards, Dr. Wong, does that mean we're just done after we finish the surgery, we never see you again?
No, that's not true. So again, we like to follow up with our patients, and we understand, again, it's a process and it's a tool. So you have to use that tool correctly. So after surgery, you're here in the hospital 1 to 2 nights on average. And again, we want to make sure that you're recovering well and that you're comfortable with the diet plan, your pain or discomfort level. Once you're comfortable, we send you home, but we see you right afterwards, usually the next week afterwards, okay? And there are bandages that we'll take off in the office. We'll again review the different diet phases, and the vitamins that are required eventually. And after a 6-week process, you're completely healed.
And that's exactly true. But most people are back to work within 1 to 2 weeks. Most people are showering like the next morning because all our bandages are like tiny little stickers that are all plastic, waterproof, which is nice. So again, surgery's come a long way. We're really happy that we have this technology at Pascack Valley Medical Center. And we really look forward to working with everybody. If you're interested in bariatric surgery, please do your research. Obviously, there's a lot of information out there. And please understand what we tried to say today, that it is metabolism that's affecting the weight. And we're learning so much more about it. And look up the gut bacteria, the hormones that are involved. And once you understand metabolism, it sort of makes sense what you see in the real world. We all know people that eat more than us and weigh a lot less than us, and it's like, why, right? And that's because they happen to have a different set of metabolism, a different set of gut bacteria, a different set of hormones. And once we understand that, these treatments become so much more effective and the great tools for long-term success with maintaining a good weight and freedom from a lot of those diseases that Dr. Wong said. So that's what makes Pascack Valley so different in how we care for patients. We expect to see everyone pretty much for a long, long time.
The rest of their life.
Right. That's what we always say, and that's really makes our program so different. So we're going to take some questions that have been sent in, and I think we have just one or two, and we'll take them. Let's see what we got.
What is the difference between laparoscopic and robotic?
That's right. So you may have heard the standard surgery is laparoscopic surgery, but what we do is robotic surgery. So there is a difference. Now, we explained some of the benefits of the robot, the precision, the 3D vision. But what's really the difference in how we do surgery?
So again, both procedures or both
Techniques.
laparoscopic and robotic techniques do require using certain instruments, usually small, less than 5 millimeter instruments. We're using screens and monitors and 3D vision to be able to see again inside your abdomen or whatever organ we're operating on. So both are very similar, but a robot, like we said, does have some of its advantages: less pain, faster recovery, safer.
Precise.
But both are very, very safe, laparoscopic and robotic.
Right. This is just the evolution of surgery. Remember, when I started training well over 20 years ago, not to date myself, we used to make foot-long incisions for pretty much every surgery. Then we moved to laparoscopic techniques on these monitors. And now the next evolution is robotic surgery with the incorporation of augmented intelligence. I think one of the things that makes this robot so incredibly powerful is that we have the ability, using machine vision, to actually write apps for what tools surgeons need. I can actually get a virtual ruler. I can do things like measure from point to point, right? I can highlight anatomic structures. These are all possible because of this digital surgery. And that's the next revolution that you'll hear in surgery. And I would imagine in the next 10, 15 years, a lot of the surgeries that you're thinking about will be done using robot assistance. We're just fortunate enough to be able to be on the forefront of that. And this is the only unit in the tri-state area of this particular robot model. So again, we're pretty proud of that. So thank you for that question, whoever sent it in. And the next question.
What does recovery look like after robotic bariatric?
Yeah, let's go over that again. What does recovery look like? Because I think everybody's afraid of that recovery process. But once again, what do you think, Dr. Wong? What does recovery look like?
So again, so recovery is actually not too terrible. Everyone's always concerned about what can they do after surgery, what they're not allowed to do. For the most part, you'll feel pretty normal again. The pain level is more of discomfort. So we want you walking around, and you will be able to walk around. You can go up and down stairs. Eventually, in a few days, when you're off the narcotic pain medications, you're even able to drive. The biggest restriction for most surgeries in the abdomen are really just no heavy lifting, usually 10 to 15 pounds. But like you mentioned earlier, we want you to shower the next day. All the bandages are waterproof, so you can hop in the shower, you can, clean your hair, wash up, do everything. Most people, again, are going back to work within that first 1 to 2 weeks after surgery. And then everyone's really fully recovered by 6 weeks. Okay?
Yeah, and you see, we're really fortunate at Pascack Valley Medical Center to have a great team of dedicated professionals that really help in every aspect of the care. From the minute you come into the hospital, you'll meet all the nurses and you'll meet all the techs and everybody that comes in contact with you. They've all been trained, and really they've been, it's just a fortunate opportunity for us to work with everybody that we work with, and our patients have been extremely happy. So thank you once again for everybody for coming. It's been about 20-25 minutes, so we appreciate you taking your time for this Facebook Live event to let us share how proud we are to have this technology here at the Pascack Valley Medical Center and how it's helped patients. So feel free to reach out to us at the link below. Check out our website as well, and we look forward to working with everybody. So thank you again, and Dr. Wong.
Dr. Sarah Wong, I'm one of the general and bariatric surgeons here at Pascack Valley Medical Center.
And once again, I'm Dr. Amit Trivedi. I'm the chairman of surgery here, and we look forward to working with everybody. Have a good evening.